Hi, I'm Jan Davis, and this program is about self-care. We'll be looking at various activities of daily living, dressing, undressing, grooming, and hygiene, and I'll give you tips on how to help your patient be as independent as possible. But even more important, I want to give you some tips on how to make your approach the most therapeutic possible, so we can encourage normal patterns of movement during self-care skills. We'll look at some patients who have abnormal movement patterns, and I'll show you how to correct these. It's interesting. We often start with self-care as the first thing in our rehab program, but it's one of the most complex things we ask our patients to do. So I'll also give you some ideas on how to grade these activities and work with patients who are frustrated. So now let's begin our self-care program. Here are a few of the goals I keep in mind during self-care training. So now let's take a look at how to develop a program in order to maximize the therapeutic value of self-care training. Remember the following points as you begin your patient's program of self-care. First, grade the activity. If a patient has limited endurance, you might begin with light hygiene at the sink. You could progress to upper extremity dressing, and as their endurance improves, you could have them assist with lower extremity dressing as well. Don't try to do too much in the beginning. And now you can put your other leg in.
Oh, sorry.
It's okay. Be sure to monitor fatigue and frustration. What typically takes 10 to 15 minutes with hardly a thought may now take up to 45 minutes with full concentration. And what you need to do to pick that leg
Don't just sit and watch your patient. Assist your patient as needed. Avoid saying, "What comes next?" or "What did you forget?" This only adds to their frustration.
There you go. Okay, come on. It's okay. How do you do with your shaver?
Also, when assisting your patient, remember to incorporate the weak side into the task as appropriate. Here I have Dale using his weak hand to help stabilize the razor as he unplugs it. Offer opportunities for problem solving. Don't do everything for your patients. Patients will become independent only when they have learned to problem solve. As your patients improve, gradually reduce the amount of assistance you give them. And finally, when assisting your patient, try to discourage abnormal patterns of movement. To do this, I try to incorporate as many of the following 5 basic treatment principles as I can during my treatment sessions. Encourage weight shift toward the hemiplegic side. Encourage trunk rotation or dissociation of the pelvic and shoulder girdles. Put muscles on length without overstretching them. Encourage your patient to come forward. Changing the position of the pelvis can help to inhibit extensor tone at the hip. And encourage scapular protraction in order to inhibit flexion synergies of the upper extremity. I'll point these out as we observe the following patients. As we begin the how-tos of self-care, keep in mind that these are only some of the possibilities. There are many ways of doing each of the following tasks. You may want to modify the facilitation of a task to meet your individual patient's abilities and their specific problem areas. Let's start with dressing. Our stroke patients should not get dressed lying in bed. It is difficult for them and doesn't allow normal patterns of movement. Instead, position the patient on a chair or a wheelchair next to their bed. For lower-level patients, this is much better than sitting on the edge of a bed. Most hospital beds are so high that it makes it difficult for them to have their feet flat on the floor with a good base of support.
That's right. And lean forward. Let your arm drop down. That's it.
Place your patient's clothes on the bed toward their strong side. And for safety, always stay on their weak side when you're giving them assistance. Here we have Lauren, who has a left hemiplegia.
So what I'd like you to do is we'll just set it here for just a second, and we need to cross this leg over again. And I'll help you cross the leg over.
I like that.
Right. There you go.
Begin dressing with the weak or the involved side.
Feel cold? Okay. Shimmy it up.
Mm-hmm.
Great. Okay, now we'll put your leg down.
Lauren, like many stroke patients, has difficulty picking up her uninvolved leg. This effort causes her left leg to shoot into a pattern of extension.
Now that's
I help her learn to control her leg by shifting weight onto her weak side.
Did you see what happened to your foot when we did that?
Slide.
It did. So what I'm going to do is when you pick up your other foot, I'm going to put a little weight into this foot, and that might help. So go ahead and try again. And instead of leaning so far back, there you go. And that helps to control that leg. Right? Okay. Right, you just pull it up as far as you can. Now, because we've been practicing standing up by leaning forward and not pushing and pulling, now you can hold onto your waistband with that hand. Right. And I'm going to have you lean forward a little bit. Hold on. Okay. Now wait.
As Lauren stands, she's learning to shift her weight forward to have a free hand to pull up her pants.
Now we'll stand up. Perfect. And you can pull your pants up. Perfect. That was great.